the physiological things that happen to your brain as a workaholic are very similar to some of the physiology of substance or drug abuse. They are both addictions. And as addictions, they're compulsive behaviors, they're behaviors you can't stop, and they're behaviors that eventually end up with bad and negative consequences. It's very different than, okay, I've got this period of time, we have a crisis or a big project that's going to take 2 weeks and I'm going to disappear. Because most jobs have periods of heightened responsibility. So it's a consistent level of being at work longer and longer. Those people, though, finally, at some point, often before they get to Karen, recognize that workaholism has a real danger and it's like a two-edged sword for them. And the way they recognize that is very much like alcoholics who are high functioning recognize that condition, which is they have consequences. So it can be personal, it can be professional, they can be isolated professionally, but it needs to be a tangible consequence that they connect with their workaholism. That's a negative consequence. And that can be a motivator for them seeking help and saying, there's maybe a better way to live than this. And it really depends on how long they've been like that, how entrenched they are, how much they're tied to material things that they think are necessary for them to continue to be a workaholic to achieve. So there's a lot of variables. Their treatment could be an individual psychologist that specializes in that issue. It could be there's groups that can be supportive. You can have group therapy. There are even organizations under the umbrella of Workaholics Anonymous throughout the United States. And then there, of course, are treatment centers that deal with addictions. I think there are certainly ways that people break the workaholic cycle by doing therapy or treatment that is less than residential. And the same is true with people that have substance use issues. But optimally, I think if your problem is significant and causing enough trouble in your life, I think the optimal level of care as a clinician is residential, that really pulls you out of that and separates you from your addiction, does not allow you to practice your addiction while you're there. You have to have sobriety, either from workaholism or from drinking. And also that place can start to work on your underlying issues in an intimate way and in a fundamental way that maybe allows you to have privacy and confidentiality and get to the root of these addictions. When they leave a residential treatment center after having been initially treated for whatever their addiction is, the primary keys really are reconnecting them to family and finding a way that family understands how this person is going to get better and what's necessary. The workplace is the second place you start. And if you get permission from the patient to actually deal with their workplace, to be able to have a conversation with their supervisor or their boss or their president, that kind of person, and say, listen, this is a problem that's not only hurting this patient, but it's going to hurt you. Because being a workaholic means you eventually burn out, you eventually have negative things happen. It's not sustainable. So I think coordinating with family, coordinating with the workplace are the two places to start in terms of aftercare.